Joining me now is Dr. Sharif El-Nahal, CEO of University Hospital in Newark, New Jersey, and former commissioner of the New Jersey Department of Health. It's so good to see you, Dr. El-Nahal. Thanks for being with us. We see these inequities. I was focusing on Maryland. There are issues in New Jersey as well, closer to home to you. Tell us how the states are doing, as far as you can tell, in your community, about the racial inequities because of lack of access, because of some resistance, understandable resistance in some communities, but also just the way the vaccine is being distributed and perhaps the way wealthier people with greater access to the internet are piling on and taking those spots.
Well, thank you so much for having me. The first thing I'll say is that we've seen the inequities of this pandemic front and center here in the community we serve since the beginning. I just remember walking around my hospital and couldn't help but notice when I was supporting the frontline heroes here that almost every person in a hospital room in that mid-April surge last year was a person of color. And everything from testing access to the ability to receive care in a timely way to now vaccination access is worse for people of color throughout this country. We are proceeding with vaccinations here, I think, in a good way. We serve a majority minority community. We have all three vaccines. We're actually day 5 of administering all three, including Johnson & Johnson, and it's going well. But we also have to keep in mind that access to the vaccination centers themselves is a really important concept that we need to think hard about across this country. It's not enough to put a vaccination center in a minority community. You have to make sure it's actually accessible and you're able to schedule an appointment if you're a person of color, knowing that there are barriers to doing that from a technical standpoint in the digital divide. So we're seeing that front and center, and we know it's an issue. We're doing everything we can to improve access here in our community.
There's also a partisan divide, not surprisingly, unfortunately, when it comes to who is willing to get vaccinated, with polling showing that Republicans are more reluctant than Democrats. Dr. Fauci was asked whether the former president, whether Donald Trump, should be telling his supporters, get the vaccine. Let's watch. This was Meet the Press.
Chuck, I hope he does, because the numbers that you gave are so disturbing, how such a large proportion of a certain group of people would not want to get vaccinated merely because of political consideration. It makes absolutely no sense.
This is more of a problem in some red states, perhaps not in Newark, New Jersey, but it's really an unfortunate outcome of the way this issue became so divisive in the last year.
Well, I think it speaks to the fact that everybody getting vaccinated should be a priority for every American. It's not just saying, hey, my community is going to be vaccinated, or I just need to get the vaccine for myself or my family. Your health and your protection very much depends on a person of color in an urban community getting the vaccine, a migrant worker getting the vaccine, or somebody who happens to live in a red state and supports Donald Trump. It doesn't matter who you are. It's in all of our interests to get vaccinated, which is why leaders of every community, every persuasion politically should be talking about this. We've been doing so here in Newark and have taken best practices from across this country to improve vaccine hesitancy. We've improved it from 40% initially to now over 60% by going to where people are, approaching them humbly, answering their questions about everything from conspiracy theories to legitimate questions about side effects. All of that needs to be done in every community, including red states.
Are you finding any resistance to the Johnson & Johnson vaccine, as initially, at least there was from the mayor of Detroit, that it's kind of a second-class vaccine, not as efficacious, even though that's a misinterpretation of the data, and that it's, sort of being, excuse the expression, ghettoized, that people are angry about it, not having access to Moderna or Pfizer?
Well, the first thing I'll say is that I understand where that skepticism comes from. It comes from, frankly, generations of systemic racism against communities of color. And folks are right to question whether they're getting what's adequate to protect them. But what I'll say is that just isn't true. The Johnson & Johnson vaccine is 100% effective at preventing hospitalization and death, just as much as the Moderna and Pfizer vaccines are. And we've had this question come up in our town halls. We get the question frequently. And we say the most important goal of vaccination is to prevent those two negative outcomes. And so it's a single shot, which is more convenient, and it gets the job done for what's most important. And also, it gets us as a country to herd immunity faster. And so when we answer this question in our community, we see a lot more willingness to take that vaccine.
Dr. Sharif Al-Nahal, thank you so much for joining us today. Really appreciate your expertise.
Thank you.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.